Hi, I'm Cian O'Carroll, and back in 2018 I met Vicky Phelan when she was looking for a solicitor to help her fight her case. She went on to win that case and uncovered a shocking healthcare scandal that has affected so many women and families across Ireland. We also became friends. Vicky went on to fight one campaign after another for women's healthcare in Ireland, and all the time fighting for her own life, fighting for more time. This is a series of conversations where Vicky and I discuss what went wrong in cervical check, how those fatal and life-changing mistakes happened, and look at what Vicky has achieved since she became an advocate for change. Hello again, I'm Cian O'Carroll, and once more I'm in conversation with Vicky Phelan. Good morning, Vicky.
Good morning, Cian.
When we were last talking, we came to the point of you telling about your research into clinical trials and finding the drug pembrolizumab. And just to quickly overview that, you were saying that you had researched clinical trials for immunotherapy drugs in the United States. You had seen one which looked interesting to you, which was pembrolizumab. You found out that it was manufactured by Merck Sharp & Dohme, who have a significant presence in Ireland. Indeed, you would have been driving past their Ballydyne plant every time you went to work in Waterford.
Yeah, I know.
And then you found out from them that one of the doctors they were working closely with in Ireland for pembrolizumab, albeit for other cancers, not cervical cancer, was Dr. David Fennelly.
Yeah.
So at this point this is all in January of 2018.
Yeah.
You've met with Dr. Lorraine Walsh, your radiation oncologist. She has sent you for a biopsy. She hasn't any more remedies for you because with recurrence of cancer, the radiation therapy wasn't an option. So she's referring you on to a medical oncologist, Professor Gupta in Limerick, Rajneesh Gupta, who is now about to meet with you. And you go and you talk to him on the 28th of January.
That's correct, yeah. So I had 2 weeks from the appointment where I had the really bad news with Dr. Lorraine Walsh, and the appointment then with Professor Gupta, and the biopsy in between, which had confirmed that this was a recurrence and wasn't a new cancer. So I spent those 2 weeks literally on my laptop researching, trying to find something to give me a glimmer of hope, so that I could go into this appointment with Professor Gupta and have a couple of names of drugs, and that I could go and say, can I not try this drug, or can I not? I suppose I was so naive in some respects about clinical trials. I didn't realise that clinical trials, I do now, have sites, so if a clinical trial is set up, usually it's starts in America, and they might have sites in Europe. Generally, we don't get a lot of sites here in Ireland. You might get one or two for, bigger trials. But generally, most of the trials, you either have to travel to the States, or, the nearest then for us here in Ireland would probably be London. So the UK will get far more than we do, obviously. But at the time, I had no notion that this was, I just thought a clinical trial that, if a drug was on a clinical trial, that surely it was available in Limerick or Galway, or that's how naive I was, I suppose, at the time. So I was looking up these clinical trials, and once I saw that there was a couple of drugs, I was kind of, I suppose, ready to ask Professor Gupta, can I not try this drug? I see it's on a clinical trial, not knowing that meant that it wouldn't be available kind of, for general cancer populations for another couple of years, really, because the whole purpose of clinical trials is to try drugs out before they bring them to market. So
and the kind of things,
go ahead.
The kind of things that you were interested in trying weren't on offer in your local oncology centre, which was in University Hospital Limerick.
No, so I remember going to that meeting armed with, I remember walking into the appointment, I could see his face because I had, wads of paper coming in with me and a notebook and all my questions written down,
This might take a while.
Yeah, I think he could see that, and I remember Jim came with me, and I remember saying to Jim, and I don't know why at that stage, but I asked him to take notes. I said, in case there's anything that he says, I said, I'm going to be throwing questions at him. I said, so I'm not going to have time to write down whatever he says. So I said, whatever he says, you need to take notes, because I want to keep asking him questions and, see if there's any other options, because I know that they're just going to offer me palliative chemo. So I want to see if there's anything else. So I remember, asking him about pembrolizumab, because I knew that at that stage that pembrolizumab was being used in Ireland in,
Right.
a number of hospitals. It wasn't in Limerick at that stage, but I didn't know that. And he said, no, unfortunately, that's not available for your cancer. And I said, but it's available for cervical cancer in the United States. And he said, yes, but it usually takes 2 or 3 years, which obviously I've discovered since. Once a drug is approved by the FDA in the United States, it takes about 2 or 3 years for the European Medical Agency, I think is a Medicines Agency, the EMA, to approve the drugs for, the same cancers over here. So we're kind of 2 or 3 years behind, which is terrible, really. It's shocking, especially when you're in the situation yourself. And I remember saying to him, I don't have 2 or 3 years. I don't have 2 or 3 years. So I said, I want to get on this drug. I said, so, can you not get access to it? And he said, no. We all we can offer you here is the Avastin and chemotherapy combination. So at that point I just said, well, I want to get a referral then to this other doctor who I had found out was prescribing pembrolizumab, albeit not for cervical cancer, but I thought, that was my best bet. So I got my referral that day to Dr. David Fendley in St. Vincent's Hospital, and it took a number of weeks before I got access to the drug, but I did get on it in the end. But I did have to use an awful lot of political influence and making a nuisance of myself with phone calls and calling Merck Sharp and Dome and pestering them and giving them a sob story and asking them could they not make an exception and give me the drug. And so I did what I had to do. I think when you're backed into a corner, you'll try anything to get access to something to give you more time.
And I heard Dr. Fennelly a couple of times talking on radio interviews and the like about this process. So he is running or leading a trial in St. Vincent's Hospital.
Mm-hmm.
And in that, he seems to be working then with the manufacturer of the inventor of the drug, because they want trials, they want an experiment to prove that the drug works and how it works best and all of that. So he was then enthusiastic about extending the reach of the drug to cervical cancer, is that it?
He was and he wasn't. He said he would love to offer it to his cervical cancer patients because he thought that it might work, and he had seen the results from the very limited study that they had done on cervical cancer in America, where the FDA had approved it. But his hands were ultimately tied, really. He said unless the only way people can get access to off-label drugs, which is what that would be at that stage, because it wasn't prescribed for cervical cancer, usually it would be at the discretion of the consultant or the clinician. But because I was a public patient, that wasn't going to be available to me as an option. So he said the only way I would be able to get access to the drug was if I paid for it myself, and if he made the argument to the hospital board to allow me to try the drug. But he said that they would see it as a huge risk, and I said, well, I'd be willing to sign whatever paperwork was put in front of me just to give me a chance to try the drug. And he did. In fairness to him, he was very upfront about it and said, this is a very expensive drug. It'll probably cost about, €8,500 per dose, and you will need a dose every 3 weeks. And at that stage, we had just started fundraising. So I had some money, and I just thought, well, whatever money I have, I'll just keep, fundraising and hope that I'll get to a stage where, I'll have enough to keep going. I was willing to try anything, so that's kind of what we did. And, by some miracle, really, in fairness to Dr. Fennelly, he managed to convince the hospital board to allow me to take the drug.
And I think they have possibly multiple concerns or issues to deal with, but they certainly have the ethical issue to deal with, and then they have presumably a concern about the hospital's own exposure should an unsuitable drug be given to somebody. And of course, but I think probably the first and most important point is just from a medical ethics point of view. But you overcame those hurdles.
I did.
And you presumably then had to be tested to see if you were suitable for this drug.
Exactly. So the next step then, once they approved this. Now, while we were trying to get the approval, I was after having my tumour tested, and I knew that I was a candidate. So I mean, that was what kind of cemented the argument, I suppose, in the end, you know, that Dr. Fennelly was able to tell the hospital board that I had a test of over 55%, and I was testing in the higher range, so between 65 and 75%, so that I would be a good candidate for this drug. And because there were very little curative options available to me, you know, that was kind of what made the argument in the end. And I suppose once the hospital were confident that I was going to be able to pay for this myself, they signed off on it.
And when did you first get pembrolizumab? When was your first dose?
16th of April 2018, Monday the 16th of April. So I remember it clearly, yeah, because I was really, really unwell at that point, and I really knew that this was my last hurrah, really. You know, I just thought, if this doesn't work, I'm on my way out. I knew it at that point. I was very, very ill by the middle of April. I remember the day before I had the drug, that we went up to Dublin, we drove down home to see my parents. It was my dad's birthday. The 15th of April is my dad's birthday. So we were going to have a family lunch, and it was a lovely day, so they'd booked a lovely place out in Cheek Point called Jack Mead's. Yep. So they have a lovely kind of a beer garden out there, and it was a nice day, and we drove down. But I remember sleeping most of the way down, kind of in and out of consciousness almost. And I was drugged up at that stage. I was taking a lot of painkillers, and my stomach was very distended. I looked like I was about 8 months pregnant, and I was wearing maternity clothes at that stage. And I remember getting out of the car, and my parents probably hadn't seen me at that point for about maybe 2 weeks. And I remember I actually didn't get out of the car. Jim had to get out of the car and come over and help me out. That's how bad I was. He had to literally pull me out of the car. I had no energy. And I remember looking at everybody's faces, because they were sitting at a height looking down at us, and all I remember is, you know, that when you see people's faces and you just go, you know, the jaw dropping. Right. And I remember saying to Jim, do I look that bad? And Jim couldn't lie, you know, fair play to him. He said, you do, Vicky, actually, you know, and God love him, he was living with this for, you know, 2 weeks on his own, and he was panicking, you know, really thought I was not going to make it. And, you know, I didn't really stay long for that lunch. But I mean, that was the first day that I realised, oh God, you know, have I made a mistake? It was the first day I kind of questioned my decision about not taking the palliative chemotherapy, because I was on no treatment at that stage, you know, nothing.
And the following day, you got pembrolizumab for the first time, and about a week later or so, you were in the High Court starting your trial.
Yeah, absolutely.
What I remember from that first day was the case was opened. Jeremy Marr, your senior counsel, opened the case, and then you were to be the first witness, as would be normal. But you were really very, very sick, and you were in an awful lot of pain, and the chair in the witness box that you would have to go up the steps to was a pretty hard and uncomfortable chair. It's upholstered, but it's, you know, it's hard, kind of leathery sort of a thing. And your aunt had to sit out of her wheelchair, and I got the cushion from that, one of those medical cushions that you could comfortably sit on, and we put that up on the witness box. It was pretty shocking, you know, to see something. It doesn't sound like a big step of preparation, you know, putting a cushion on a chair, but that doesn't happen normally. And then you gave your evidence, and it was very affecting on everybody who was in the room. But I think the sight of you, the clear, grave health or ill health that you were in, was probably even more affecting on everybody there. And there were quite a few people in that room who were upset at the end of your evidence.
I remember the stenographer, actually, because she was sitting right opposite me.
Yeah.
That poor girl, I still remember what she looks like. All I can remember is she had mad curly hair, and she was sitting right opposite me. I was looking straight at her, and she kept crying, and she kept mouthing to me, you know, because she was, the tears were literally running down her face, and she just kept kind of going, so sorry, you know, like just mouthing it to me. And I tried not to look at her because she was upsetting me, you know, it was hard enough to be up there. But I could understand where she was coming from, but I couldn't even look at her because then I was getting upset, you know. And thankfully for me, I suppose, with the layout of the courtroom, I couldn't see my parents or Jim or my best friends. They were sitting behind me. But I could hear my best friend, Maria, she's an awful softie anyway, I could hear her sniffling. And my aunt, who had given you the cushion, she's another one, she's not able for this kind of stuff. And I could hear the two of them kind of sniffling, you know. But thankfully I couldn't see them. I think it was, I often think, you know, if I was able to see my parents and my family while I was giving evidence, I don't think I would have been able to do it as effectively because I would have gotten too upset, you know. So I was able to do it because I couldn't see them. I knew they were there, but because, as you know, some of the questioning was quite difficult, you know. Some of the questions were very hard to answer, particularly with my parents there, and, you know, so, yeah.
It's very personal stuff, and, you know, in some ways, it's unnecessary. It's an unnecessary intrusion. We did that to you because those were questions that were asked by your legal team. The other side really handled you with relatively kid gloves, and that's typically the case in situations like this because they don't want to be gratuitous in their questioning of a person who is clearly an innocent in such a situation. Whether fault is acknowledged is another matter, but either they were at fault or they weren't, which is the essence of a trial, but nobody could ever suggest that you were at fault in any way, no matter what the outcome of the case. Now, obviously, you successfully proved beyond, I think, any doubt with the experts that they were clearly at fault, and as a consequence of that, by the third day, they were now finally talking about terms of settlement. But it was your own legal team who put all those questions to you, and I sometimes wonder, do we go too far in trying to bring out the extent of the harm in a case where there is really devastating harm? You see, there's a cap of 500,000 euros on general damages for pain and suffering in a case. So if you have a person of, you know, a young person who is going to lose many years of their life as a consequence of a harm, that's enough. That's maximum damages. So why even ask them anything else?
Yeah.
And yet there's this compulsion there to tell the story, and it's ours, you know. It's so I think hearing what you're saying and how difficult that was, it's probably a conversation that we should have more with people in cases where, you know, the damages are going to be at the maximum level anyway. So perhaps the simplest thing to do is just to brush over these things. Now, I don't think it was gone into in tremendous detail, but even addressing it is, as you say, very challenging when you're talking about the intimate things in your life in front of your parents.
Yeah, that was difficult for me. And I know it was one thing that Jim was certainly worried about talking about had he had to give evidence, you know. That was one of the big things that he was, you know, very reluctant to have to talk about, you know. Yeah.
Because you're very good at talking about very private matters. You're very good at talking about the intimate things in your life. You're great at talking about sex directly, dealing with how this disease has affected you and how it affects other women. But few enough people are, and that would have been very hard, I'm sure, for Jim. But he was lined up for the following day, day 4, I think, and the case settled at the end of day 3 and was then ruled on day 4, which was that day when people probably first really heard about you.
Yeah.
Just back to pembrolizumab. That time around the trial, would that have been the low point, or did things get worse than that? Did things get lower?
No, it didn't get worse. It actually improved after that. That would have been probably the worst part.
You were pretty sick after your first administration of the drug.
I was very sick, yeah, very sick. We put in a horrendous, you know, night here at home. When we came home, I got very bad reaction to it. I had really high temperature. I was hallucinating. I actually don't remember most of the night. Jim actually wanted to bring me to the hospital, and I said, "There's no point bringing me to Limerick Hospital. They won't know what to do. you know, there's a new drug. I said, if you're going to go anywhere, we drive to Vincent's. I said, but look, let's just wait it out. You know, I kind of said, just keep giving me something to bring my temperature down. And we managed to get through the night somehow. And I improved. You know, I wasn't as bad the following day. I still had temperature and shivers and shakes. But, you know, after about 2 days, I felt almost normal again. And I think, you know, it was after the first week, really, I started to notice the difference, you know, that I had a little bit more energy. I didn't have as much, I wasn't as tired. And within 2 or 3 weeks, my stomach started to go down. So I knew it was working. You know, for me, it was a very physical thing. You know, my clothes were starting to get looser. I didn't have to wear the maternity trousers after about a month. So, you know, I knew it was working ever before the scan in June.
And when you're getting it, you're in a room in Vincent's. What does that look like, and how is the drug administered?
So you're just in the same room that I would have been in, no, not in Limerick, but you know, you're in the same room that everybody goes to, whether you're having chemotherapy, immunotherapy, or whatever type of drug you're having. So you're in the chemotherapy ward, and there's about the one in Vincent's is much nicer than the one in Limerick where I had been previously, and it's a big, large room, kind of, and everything is. You have separate beds with a curtain in between each bed. So there's about 12, 14 kind of, you know, beds in a row. And what you do is you go up and you have your bloods done. First thing I have to do when I get up to the hospital is to have my bloods done first thing. So they always see where your bloods are at, and that always determines whether or not you're going to have the drug that day. And that's the case for every patient who's having chemotherapy or immunotherapy. So once your bloods are good, as in, you know, your hemoglobin count, your white cell count, all of that, then, you know, once the blood results come back, then they authorise the drug then to be mixed. Because with pembrolizumab, they only mix it on the day. Because it's so expensive, they wait until they know you're definitely getting it before they make it in the lab. So that takes about another hour and a half. So most of my morning is spent having the bloods, then going off for a coffee, waiting for those to come back. And then when the bloods come back, they mix up the drug, and then that takes another hour and a half, so I go off and have lunch, and then I come back, and the actual administration of the drug only takes about a half an hour, and it's intravenous. So when I started, obviously I was getting it intravenously in my arms, but now I have a port. So my veins started failing really after, you know, and I had only 5, when you think about it. It was from the chemotherapy, you know, my veins just were poor to start with anyway. I don't have good veins. So after about 6 months on the pembrolizumab, you know, every time I went in to get a vein, you know, it took about half an hour or 2 different nurses to try and find a vein, you know, and they were going for the smallest ones then down here, which are really sore, to try and get needles in. So eventually I said, look, can I not just get a port in fitted so that it will be easier for administering, and, you know, I'd be in and out faster. So I've had that for the last, you know, 18 months, I suppose.
That's still there. That's a permanent.
Yeah. It's permanent. Well, yeah, they'll take it out eventually, but yeah, it's just in under the skin here, a little bump, and they just you know, locate the kind of the centre of it, and then they you know, stick the needle in, and we're away. Then it's fine.
But you may not know the answer to this, but I was just curious when you were saying that they mix the drug up in a laboratory in the hospital. Do you know how that happens, or how that works rather?
I asked actually about that, and they have to put it into a special machine. So they have to put it into some special machine that mixes it up. That's all I know. So, and that takes about an hour and a half. So, you know, you'd often see these machines. I've seen it on a couple of documentaries where you see they kind of they're unusual. They kind of mix them at a certain speed or temperature or whatever. So it's a special machine anyway that makes this drug. And it can only be administered once they know my bloods are good, because otherwise it's wasted, and that's a lot of money obviously and it's only a small bag. The actual drug itself is 200 mils. That's all I get, you know, when you think about it.
And is the recipe as such, is it the same for you as the next person?
Yes, it would be. Yeah,
right.
It's the same. Yeah, exactly the same. Yeah.
Okay. And then you receive your administration of the drug, and then what? You just up you get and head home? Yeah,
and head home. And I mean, you know, when I think of how my treatment was when I was on chemotherapy, you know, 2014, and the last 2.5 years on Pembro, I mean, I've driven myself up to the hospital on most occasions. Then I started taking the train before COVID. So, you know, I travel myself and, you know, make my way to the hospital and go about my business. And I usually meet people, you know, friends for lunch while I'm up there. You know, and I make a nice day out of it. So, and it's not onerous, you know, and I drive home myself or get the train home, and I'm not, you know, overly tired. So it has never felt like an illness, you know, really, you know, over the last 2.5 years. I've had a great quality of life. You'd
have to say that over those 2.5 years, you've led the lives of about 10 healthy women. I was talking to Jim a little bit earlier, your husband, and he just said that things are never dull with Vicky, you know.
No, they're not.
That there's always something going on was his point. It's always something's going to happen or about to happen, and you've been incredible. But it's wonderful, isn't it, to have that gift of time.
That's exactly what it is, Cian. You know, it's a gift. It really is a gift, and that's the way I've treated it for the last 2.5 years. I think, to be honest, I've done more living in the last 2.5 years than I did in the previous 10. And that's why, you know, I jump at anything that comes to me, you know, any offers of nice, you know, experiences or opportunities. And, you know, we went to New Zealand for Christmas last year, and I went paragliding. You know, I'll try anything now at this stage in my life. And I think, you know, it's a pity that it took this illness and this situation for me to appreciate life, I suppose, and how important it is. You know, and that's why I've done as much as I can, I suppose, over the last 2.5 years while I've been well.
Well, you're talking about the nice experiences, but what I think about when I think about how you've used this time is a little bit different, and I think we should talk about it in more detail in the next episode. But it's how you went on from you fighting to get pembrolizumab for you, to you fighting to get it for other women, then extending it to a wider group again, not taking no for an answer from government for a whole host of things, then campaigning individually on behalf of a whole host of women who were also affected by failings in cervical check, then fighting the Department of Health to have them set up a support group for those people and their families, then fighting for a care package that was going to be provided for all of those people, and on and on and on. So, I mean, that's what you've done with your time, and it has been tireless. And I know you're not here to get, you know, all sorts of praise heaped on you from me, but I think it's important that be acknowledged, and at a time when time was known to be limited, that you spent so much of it on others, and I think that that's the most remarkable thing. So, and as I said to you before, perhaps in texts and private conversations, you know, that's what makes me most proud of you as another human being, just to be part of the same species. But having said all that, I'm not going to give you the right of reply, because you'll only say something self-deprecating. At that point, I think we'll take another pause here in our long and meandering conversations. And, well, they're not meandering. I mean, we are moving in a direction. We are. Hopefully, otherwise people will never pay attention to any of these. So once again, Vicky, thank you very much for your time, and I'll talk to you again soon.
Thanks, Cian. It was a lovely conversation out today. Thanks a million.
Hi. Vicky and I hope that you've enjoyed that episode and you're finding the series informative. If there's anything else that you'd like us to discuss or touch upon, please mention it in a comment below. And to be informed of future episodes, hit the subscribe button.